What is the health disparity that you have identified? I have identified that there is a health disparity among African American adolescents and increasing suicidal rates. How big is this disparity? Suicide among African Americans between 15 and 19 years old has now become the third leading cause of death. Although overall rates of suicide attempts among adolescents declined from 2001 to 2005, the suicide rates in African Americans, who are traditionally lower, did not. In 2014, the Youth Risk Behavior Survey reported that about 27.7% of African American adolescents felt sad or hopeless almost every day for 2 or more weeks in a row. This overall rate is higher compared to any other race, which was at 23%. African American females were actually about 6% higher than any other female race. What is the cause of this disparity? Although some risk factors for suicide differ across racial and ethnic groups, depression is consistently identified as one of the most significant risk factors associated with adolescent suicide behavior. The CDC has done special research for strategic direction for the prevention of suicidal behavior. They tested the correlation of family support, peer support, and community connectiveness. They noticed that children who lived in low-income areas were also the ones who claimed to have little to no family support. Being low-income can cause the parents to work more and not be able to spend as much time with their children. Low-income families also often lived in low-income housing or bad neighborhoods, which could cause the children to be exposed to drug culture and crime. The children who said that they went to church, attended after-school care, or participated in sports seem to have lower rates of depression. Being involved allows the children to make friends and feel that community connectiveness. What plans are currently in place to fix this disparity, and what are some of your ideas to fix it? I believe that we can start fixing this disparity within the school system. Almost every state provides a counselor for their schools, but only a handful actually have mandated policies for their counselors. The mandated policies mostly say that for every 500 students, there is one counselor. Whereas to non-mandated schools, they're going to have one counselor for every student that they have. So I would like to see all schools have a mandated policy for their counselors, including that they would be required to visit and introduce themselves to every classroom within the first 2 weeks of school, meeting with the children who are having problems, whether it be academics, social problems, or behavioral issues, and to have a more realistic counselor-to-student ratio. Aner Elementary right down the street here actually has a unique system in play where the teacher will meet with the parents before school starts at their house. So they see their living conditions, they kind of get a feel of what the student goes through on an everyday basis, and it lets them plan and kind of know what to expect from each kid ahead of time before school has even started, and it seems to be effective. Lastly, I recommend that communities provide more events for the children outside of school. This could help the kids build social skills at an earlier age and provide that community connectiveness that they've been talking about that really helps them deal with depression.